Welcome, everyone. I'm Dr. John Whyte, Chief Medical Officer of WebMD. I host a show called Coronavirus in Context. I hope you'll check it out. Today, I want to talk about reopening, right? Some of us are getting stressed as things start to reopen, and how do we manage that, right? We all have kind of become used to pandemic life, and now it's changing again. So people sometimes have challenges dealing with uncertainty. Let me know how you're feeling. Feel free to drop it in the comments. And I actually have asked my good friend, Dr. Mena Mirhom, to join me today. He's a psychiatrist, treats adults in New York at Columbia, and he's going to help provide some guidance. I want to talk to him about it. Again, we're going to talk about what are the issues that people are having as we start to reopen. And again, for those that are joining, I'm Dr. John Whyte. I'm the Chief Medical Officer at WebMD. And the goal is to talk about what are some of the problems that people are challenging in terms of, all right, so let me see. I'm still learning Instagram Live. I don't know if all of you are doing as well. So again, the issue is, what are you guys experiencing as offices are reopening, businesses are reopening, schools are reopening, and I'm glad to see that. My kids are young, and I think they do benefit from at least having a hybrid. So how are you feeling? It's not about turning an on-off switch. It's about recognizing that it can be challenging, and it's going to take time, and it's gradual. And I'm just checking where Dr. Mirhom is. So I want to thank folks for joining. So tell me what's on your mind. Again, I'm going to see if I can get Dr. Mirhom, but I'll answer your questions in the meantime to see if other people, have questions. So again, as you think about stress with reopening, we have to recognize that it's okay not to be okay, right? Everyone's not going to feel great, and you should acknowledge that, and that's okay too. It's going to take time getting used to the new normal in many ways. And how are we all dealing with that? How are we managing our mental health, our physical health, our spiritual health? All of those things are important. A couple of folks are sending in some vaccine questions. Let's be honest, no one knows for sure whether we're going to need boosters. The data about the vaccines, it's not that they were only effective immunity for 6 months, it's at least 6 months. That's how long they looked, and people still had immunity. That doesn't mean it's 6 months and then it falls off the cliff. So there's still that as well. So that's an important point to consider. So, we might be having some technical issues with Dr. Mirhom, but you might have to reschedule with him if we can't get it to work. But, I really wanted to take the time, first of all, to thank everyone for what you're trying to do to help keep people safe, to become informed, and what do we do to address it? I see Bob asks about subscripts for deaf viewers. I'm going to ask about that and find out, what are we doing about that? So thank you for bringing up that point. So I hope you'll watch the show Coronavirus in Context. It's at webmd.com. Check it out. It's a daily news show where we're really trying to provide you the best information. A little later today, I'm going to talk about, are we in a fourth wave? What's really going on with that? So let me see some of these requests. Let me see if I can get Dr. Mirhom to join. I just, accepted it. So let's see what happens. And here we go. We got it to work.
Dr. Webb.
So I'm delighted to be joined by an expert. I was trying to get some advice, but to welcome Dr. Mirhom at Columbia University. And let's talk a little bit about that stress that people are experiencing about, reopening, and they had some certainty about what's been going on for the past year, and now there's uncertainty. So walk us through what people might be experiencing and what kind of tools and resources are out there to help them.
Sure, absolutely. Thank you so much for having me. It's always a pleasure to see you. So one of the first things we want to keep in mind is that, as you mentioned, that uncertainty is handled differently by different folks. So one of the first things we try to tell everyone who's in this position is some people are going to feel one particular way versus, you might feel differently. So understanding first that your reaction can vary, and that is okay. Some folks have been very excited about reopening. Some folks are the extreme introverts, the patients that I've had who said, oh man, lockdown is ending. I'm going to have to leave my house and see other people.
Mm-hmm.
So that's the first thing that we want to sort of keep in mind as we're approaching this. And then secondly, we want to normalize that variety of reaction and know that even though there is tremendous uncertainty that we've really been experiencing throughout this year, there's much more that we know now than we knew a few months ago. So you want to harp on or sort of remind yourself of what you do know, the efficacy of the vaccine, the safety of a lot of these CDC guidelines that have been coming out, and remind yourself that, hey, there's much more that we know now versus what we knew in the past.
And people should acknowledge their feelings, right? They should, in some ways do an inventory of how they're feeling, admit how they're feeling, and that's okay. Some people may feel guilty about that they've been able to stay inside while other people had to go to work. Other people might be mad because of that and kind of bring up all those feelings. So that's an important step too, isn't it? Listening to how you're thinking about everything.
Absolutely, absolutely. And that acknowledgement sometimes can be, in and of itself, sort of a way to exhale. Say, okay, you know what? I am feeling this way, and this is okay. The fact that I don't feel, I've had some patients tell me, my sibling or a family member feels totally differently the way that I do. How come I'm not as excited about reopening as they are? And the reality is, what we know from data is, when you're studying major disasters like Katrina, things like that, when they've looked at folks afterwards, they saw this spectrum of reaction depending on where you are socially, where you are financially, where you are, we're certainly not all in the same place all the time. So like you're saying, that inventory and knowing where you are and accepting and sort of walking through it is critical.
Everyone's talking about micro steps for
Yeah,
everything.
yeah.
So talk a little bit about what do we mean by micro steps? And as we think about reopening, what are some of the micro steps that listeners can take?
Yeah, with micro steps, the very important point here is knowing that your individual pace it's what's going to guide, your process, right? Everyone, depending on what state you're in and, where things have been for you, you want to know that you're going to go at your own step-by-step process. You don't have to go through anybody else's huge steps. Some folks are excited. I saw you were speaking about people going to sports games, right? And kind of being in these huge arenas. For some folks, that's the next micro step. But in reality is every one of us is different. So for some folks, we want to keep in mind the fact that our social skills at the end of the day are skills that can get rusty. You may not have had some time, as an example, right? If you haven't played sports in a while and you're going to pick up a basketball again, that jump shot may not be the same, right? So how do you ease your way into it? Maybe it's not a huge stadium outing. Maybe first it's going out with friends or loved ones who are sort of vaccinated and you feel comfortable with, and it's not a new social situation. So those micro steps or those baby steps, the guiding principle there is that that it's at your own pace. And the pace that you're following is going to be dictated by a personal choice that you make with your friends and your family, that's individualized.
What do you hear that people say they're learning from having spent so much time in homes? Some of it, for some folks, is a greater appreciation of family. Others learn, hey, they don't really need to travel and can be.
Right.
Others realize that they really are extroverts and need to be around people. What are some of the things that you're hearing from folks?
There's been such great variety in that question. That's been one of the nice things of being sort of forced to sit and reflect for a year, maybe a bit longer than what we're used to. But what I'm hearing a lot is it's the opportunity first to understand who you are. One of the hallmarks of therapy, we're told, is that the therapist sort of introduces the patient to themselves, right? And oftentimes we think, well, I know myself, I know my tendencies, what I like, what I don't like. But when you're forced a bit to sort of have a little bit of quiet and a little bit of less entertainment or a little bit less of the things that we usually would do, you understand a bit more about who you are.
Mhm.
And in some regards, sometimes when you're spending more time with family in a different capacity, there's that element that's been, a period of growth or
Mhm.
an opportunity for growth. And for some folks, it's professionally as well. Some folks have been telling me that they're learning how much of my job I can do, while at home. How much do I really need to be able to be in person, regardless of my position, how much I need to be in the office or not. So in all these different domains, socially, professionally, and personally, there's been opportunity for growth if we look for it. That's kind of been the key.
So we know that physical health and mental health are connected. There's no mental health without physical health. So what should people be focusing on more? Diet, exercise, sleep? I'm not going to let you say all of them. They're all important. But if you had to spend a little more time on one than the other, which would you pick?
If I had to pick one thing, I would say because as you said, they're all important, but the
Hmm?
one freshest in my mind, I was having a long discussion with a patient this morning, actually. Patient suffering from several different issues in terms of depression and anxiety. And she said, Dr. Mirhom, it really helps me so much when I'm just physically active, especially these days in this season. This is why I would emphasize it. If you're able in this period of time, depending on where you are in the country, if as long as not maybe Alaska, right? If it's a little bit nicer outside and you're able to spend more time outside, having some more physical activity, that just goes a long way because it can sort of have a trickle down effect to all the other elements of health. If you're spending more time being physically active, hopefully you drink a bit more water, you sleep a little bit easier. I'm not saying that exercise solves all your problems, but I think if we're going to emphasize one thing with beautiful weather, being outside, just getting a little bit more sunlight,
Okay.
and being more active is tremendous for physical as well as mental health as well.
Now, everyone's not going to be able to get an appointment with a therapist right away if they need one. What are their resources, either online or apps or other strategies that you might recommend to listeners while they're waiting, perhaps to get an appointment?
Yeah, so one of the things that's been another sort of positive of this very downside of the pandemic has been actually much greater accessibility to
Hmm.
providers these days because of tele, right? If it's difficult to get in person to a provider, but these days you're able to jump on an app, and there are several where you can speak with a therapist by video, as we're doing now. Some therapists are
We did have some
doing.
issues.
We did. Provided that you don't have the issues, that I'm having as the old guy that I can't navigate IG Live,
And
but
we talked ahead of time just so people so that we wouldn't have challenges.
yeah, I was sitting there pressing all the buttons. But for the young people who are maybe joining us on IG Live, or people who are just more tech savvy than I am, that's one great outlet, is knowing that you're able to have therapy as well as psychiatry now accessible, through your phone. But if you're not doing that, there are several apps now, and this has been a huge space in the mental health world of meditation, guided meditation. An app like Calm. There are many. I don't endorse any one particular one, but there have been some great studies to show that if you have a guided way to go through some of these
Mhm,
coping mechanisms, and some of them have been actually quite good at even allowing you to evaluate your daily mood,
mhm,
check in and say, oh, here's where I am, kind of 1 to 10, or here's a color for my mood, or here's the name I would call it.
mhm.
I would say that's sort of a key other resource that we'd be able to utilize.
Right. Well, I just wanted to take some time today to let folks ask questions about some of the challenges and emotions they might be experiencing as we're starting to reopen. And this is going to continue for many months. And as we've talked about, there really is a mental health pandemic that's going on, as well as a physical infectious disease pandemic. So I'm going to look forward to engaging more with you, and we'll practice on getting on. Thanks for taking the time, and
Thank you so much.
chat again very soon. Dr. Mena Mirhom at Columbia University.
Looking
Thanks.
forward. Thank you, Dr. Whyte.